Yeah, thank you for giving me the opportunity to talk about this important topic. As we know, the COVID-19 is a virus which is an RNA virus. It's affected the whole world and caused real havoc in the world with lots of deaths and high mortality rate involved with that and high morbidity. There's lots of patients who've been unwell, but usually they would recover in with 4 weeks time. But there are some patients who would not recover in that short time and they will continue to have symptoms. Even if they didn't have a very symptomatic COVID-19 infection, they could sometimes have symptoms after that period. So it continues between 4 to 12 weeks, and that's like a long COVID. But when it continues further than that, like more than 12 weeks, then that is what is given the terminology long COVID syndrome. So this is the basic definition of that, and it affects about 2 to 25% of COVID patients. So that's what post-COVID syndrome is. There is a constellation of symptoms that are attached. As I said earlier, that they might not have the same symptoms during the COVID, and they might have different symptoms post-COVID. So if we start with respiratory system, which is kind of the specialty we deal with, it affects the lungs, so it can cause shortness of breath, which is a very common symptom that people get. People can have cough, and it could be dry, or they could bring up phlegm with the cough, or they could have other symptoms attached with that, which means that they are tired and their exercise capacity is reduced, so they cannot do what they were able to do before the illness. They could have heart-related or cardiovascular-related problems, so they would have irregular heart rate or tachycardias, which means fast heart rate. And that's very common problem we see when patients come in a post-COVID review in the clinics, and also chest pains and palpitations. These are very common problems in cardiovascular system. They would have general problems as well, which includes, sometimes even fever. But the commonest problem is fatigue. They become very tired very quickly. And they can have neurological problems as well, which could mean that they have dizzy spells, they have foggy appearances, or they lose memory, or their concentration span is lost. They can have headaches. Some people find it very difficult to sleep. Sometimes, people are not eating well, they lose weight, they could have dizziness, delirium, and peripheral neuropathy. So these are kind of a broader cover of what post-COVID syndrome could involve, but there are certain things that obviously this is very broad, common ones that I've covered, but there are others which could also happen rarely other patients. I think if for general public, I think it's very important advice that there should be a follow-up after COVID infection, especially if people are having these symptoms if they're not well. So the first advice is always to go to their GP, the general practitioner, or family physician to see them. And they would have some common tests to offer along with, the type of involvement or symptoms they've got. So the common things they can do is some blood tests, checking for inflammatory markers and infective markers and prognostic markers related to COVID. Or they could do ECG, heart racing. They could do an echo scan of the heart, or exercise and testing. And these things are very basic tests that could be arranged through the general practitioner, and some of them are very much geared up to look after post-COVID syndrome patients. So it's right that people see them, but it all depends on what kind of symptoms they've got. Somebody's got a chest problem, and sometimes even a CAT scan is required to look at if they have pneumonitis, which is persisting after a long time, and they sometimes require adequate treatment for that. And the same with, if they have memory problems, brain-related problems, dizzy spells, they sometimes need MRI of the head or CT scan. So more sophisticated investigations have to be considered. Same for the heart, that echo scan or even an MRI of the heart is sometimes required for people having, unexplained tachycardia, unexplained fast heart rate. So it all depends on the kind of syndrome and symptoms the patient has as to what kind of investigations would suit them. But there's a constellation of investigative work that could be put in place to help these patients. The GP, general practitioner, would sometimes refer them to a particular specialist, if it's a cardiologist or a chest physician, depending on their symptoms. So these are kind of the investigatory lines that one could follow for the post-COVID syndrome patients. Yeah, again, as I said, there's so many kind of presentations of post-COVID syndrome, and depending on what the problem is, then that has to be addressed. And there are some general measures that have to be adapted as well, some general scheme of things that would help these patients. But there are like other things are like common, things that would help. So again, physiotherapy has a very important role, especially if people are breathless. They could teach them to do breathing through the nose, simple measures like that, breathing through the nose, but with slow, breaths rather than having shallow, rapid breaths. They have deep breaths and slow breaths, and that can help improve breathing. And it is a slow process. It doesn't improve immediately. It can make people frustrated, anxious, and depressed because it's such a long process. It can take that long time. But certainly physiotherapy would have a very positive role to play and help in certain patients, especially people with breathlessness and sometimes cough, where they are finding it difficult to bring the phlegm. And then occupational therapists or OT, we call them, can help people as well, quite appreciably. Sometimes psychological therapies and psychiatric background help if people are very much anxious and depressed even. And there's a lot of patients who've developed depression after the phase of COVID-19 problem. And sometimes they require rehabilitative work and rehabilitative medicine, especially people who spend time in ITU, intensive care unit. The general measures that I'll now come to, which are obviously are important, is to make sure that they have a good, healthy lifestyle. They have to look into the lifestyle because the blood pressure can shoot up, heart rate could go far. So they have to work around what symptoms they've got and how to improve them. So sleep is very, very important, that they get adequate 8 hours sleep so that they're getting refreshed from their sleep as well and have more energy in the day. And they should have, given themselves plenty of time to recover, especially people who are in a busy job, who do have symptoms post-COVID, the post-COVID syndrome, but want to go back to what they were doing, at least wanting to run, hospital people, doctors going to work, businessmen wanting to go. I think they should take it very slowly. This is a very general and very important advice we can give to those people. And again, healthy meals are very, very important, especially high protein diets, having more emphasis on fruits and vegetables in their diet, even vitamin supplements. If they have low vitamin D, per se, for instance, so vitamin D has been very important in COVID-19 related illnesses. And the same with the water. They need to get themselves adequately hydrated. So they need to have at least 8 to 12 glasses of water, a rough sort of amount of fluid intake. All these things are very, very important. And as I said, that depending on what other problems come across, like a lot of people do get pneumonitis in a long COVID syndrome, and they can be helped by longer use of prednisolone or steroids or dexamethasone treatment. So some sort of steroid treatment is required in these patients in the longer run and proven on these trials, evidence is. But obviously it's a new disease and we're learning as the disease progresses. And again, we talked about broad treatment, but I think the advice which I want to give again here through this forum is to make sure that people understand that the disease is still around and people can get it, and it spreads very fast. So not to forget, the mask is an important protective thing to protect themselves in the first instance getting COVID. And not to get into post-COVID syndrome situation at all. And the same with regular washings of their hands and making sure they're social distance, 2 meters apart, and also, try to meet people in the open spaces rather than confined spaces, or work in open spaces and open good ventilation in the room where more people are working together.